Hi. Patient having testicular biopsy several times, no sperm, uh, lost the hope in the science, then was advised to do two techniques, or maybe three now. The first called stem cell injection inside the testicle. The second is the exosome injection. And the third is the PRP, which is the plasma rich protein injection inside the testicle. In this video, we will introduce and interview one of the experts in this field. He's a professor in Cairo University in Department of Andrology, and he is the president-elect of the Middle East Society for Sexual Medicine. So we are welcoming Professor Dr. Muhammad Arafa. And in this video, we will have first an introduction about how to speak about these techniques and how to discuss the patient, how to discuss it with the patient and with the doctors. Then there will be proper details about the studies up to the January 2026. And the reason for that, because there might be some changes happening because it's an ongoing research. So all the information is until this date. Lastly, we will speak about the recommendation or advice that we think will be beneficial for the patient and the doctors. Maybe this could be followed in YouTube channel, but let's start and welcome Dr. Muhammad Arafa. Before I start, Dr. Arafa, I will be the devil advocate and I will speak about I'm a patient, I'm desperate, the science couldn't solve my problem, so I want to do these techniques. So why you are preventing me? Number two, I'm a doctor. I think there is some research support that there is some studies in research in animals showed that with these techniques, they found spermatogenesis improvement until sperm. So why you are preventing me also to apply this technique for these desperate patients? So first of all, we start to speak with Dr. Muhammad Arafa, and welcome.
Thank you very much, Dr. Muhammad, for this introduction, and thank you for choosing this very important and timely topic about the stem cell and the PRP and the exosomes in male infertility. This is something that we hear of from the patients on daily or weekly basis because they hear it in the social media and they are curious about it. So let me answer you as a patient. Uh, when you are desperate, when you don't, when you are very eager to have child and you don't know what to do, this doesn't mean that you put yourself as a research subject in a research that is not still regulated. We don't have any long-term information about its safety. Nevertheless, its efficacy. But the first thing is the safety. Second thing, if I'm going to answer you as a doctor, we as doctors are obliged to do ethical research. We are obliged to follow ethical research protocols. We cannot use incomplete, uh, aberrant, or non-homogeneous research protocols and research outcomes to tell the patients uh, that this is a treatment option. So this is why I discourage patients and doctors from using these techniques as as treatment options.
Thank you so much, Dr. Arafa. And we can start by explaining to the audience about the techniques in scientific point of view, how this techniques is happening. So if you can start to explain what does it mean stem cell injection, then we go to the exosome, then we go to the PRP in brief.
So the stem cells, to those who doesn't know them, they are cells that are having the capability of uh, growing into all forms of cells. So it is the cells that from which all our body has grown. During an embryo, these are the cells that form the embryo. They can develop into a heart, develop into a liver, develop into a testis. So they have the capability of changing into any type of human cell. Theoretically, if these stem cells are injected in the right position with using the right stimulation, they can grow into these cells. So if we inject these stem cells in the testicle with the right stimulation, they theoretically can form sperm at the end. So we have different types of stem cells. We have the spermatogonial stem cells. These are we get the mother cell of the spermatogenesis, which is the spermatogonia, and we stimulate it. And this is the most logical one. Then we have the mesenchymal stem cell. We take any cell from the body, like the skin or the fat, and then we stimulate it to form stem cells, spermogenic stem cells. Or we get another cell that and from other not from the human, and we stimulate it to form cells. So we have different types of stem cells. The theoretically these stem cells, as I said, should be injected, should be extracted first, then cultured to expand them, and then injected inside the testis. Use some medications or some products to stimulate them to divide and make spermatogenesis. This is the stem cells. What about exosomes? Exosomes are extranuclear vesicles that contain lipids, proteins, minerals. They have the capability of stimulating the cell to proliferate, so and stimulating the cells to divide. These cells doesn't have genetic material, but they are full of growth factors and other substances that are important for cell proliferation. Coming to the PRP, this is plasma-rich protein. That's the plasma. Our blood contains the blood cells and the plasma. When they take this plasma and concentrate it, it becomes rich of proteins, rich of growth factor like insulin growth factor, the epithelial growth factors, vascular growth factors, and all of this can help into decreasing oxidative stress, decreasing inflammation, increasing proliferation. So they are maybe increasing vasculogenesis, so they can help to improve the vascular tissue.
Thank you so much, Dr. Arafa. So, if you don't mind, we need just to explain what is the studies and results done for now, until now, January 2026, in stem cell research, then exosome research, and then PRP research in animals and in the human.
So collectively, these studies are very few in animals and in human, and not only few in number, but few in research subjects. And the protocols are very different from each study and other. Coming to stem cell, for the animal studies, we have something between 7 and 8 studies. Only 3 of them have identified sperm either in the ejaculate, one of them in the ejaculate, and 2 found sperm in the testicle. And the others, it's not clear what the outcome is. They're talking about steroidogenesis or the hormones and hormonal production, and some sort of spermatogenic cells without definite outcome of sperm at the end. Coming to the human studies on stem cell, we have only four registered studies that are there. Again, none of them are randomized controlled studies. None of them are controlled studies actually at all. The protocols are again different from each study to another, and there is no one of the studies is still registered without any results coming out of it. The other three studies, one of them stated that there was increase in the spermatogenic cell count and sperm appearance semen. Only this was said. Nothing regarding the morphology. Is it a complete sperm? Is it a mature sperm? Is it a normal sperm or not? Uh, even if it is a sperm or not, we are not sure of this. The other two talked again about hormone production with little emphasis on spermatogenesis. So as you can see, is the evidence here is very, very, very low, and this is why it is not all the international societies are not recommending stem cell therapy up till now. Coming to the exosome, even less studies are there, both animal and human studies. For the animal studies, I believe there are 2 or 3 studies, and the 2 of them said that there was appearance of sperm in the ejaculate of the animals. And for the human, it's only one study that I found in the literature. It is done with, again, very few number of patients, not less than 5 or 6 patients, and the results are again not properly documented. They said again there were few sperm appearing in semen, but we are not yet sure about it. Although the exosomes are the most approachable, or I think in the near future, this will be the first thing that can help us. And I will say why later on. Coming to the PRP in the animal studies, there are more than 7 or 8 studies. The results of the studies here are even much less than the stem cell. Some of the animals are not only azoospermic or non-obstructive azoospermia. Some of them are having some sort of sperm, and they're talking about improvement of the sperm quality. Only 2 studies talk about azoospermic or induced azoospermia in animals, and the PRP they talked about the hormone production without anything regarding the spermatogenic sperm appearing in the semen. For the human, it's again with patients, mainly with patients with lowered count, motility, and morphology, normal morphology, and the results are insignificant or aberrant. For azoospermia, I found only one study, and the results were again not satisfactory. So again, very, very, very low evidence in the literature, and we cannot count on that.
Regarding the complication, which is the most important um, point that could prevent us from applying this technique as a standard solution, would you mind just to tell us, Dr. Arafa, about the complication in stem cell injection inside the testicle, the exosome, and the PRP?
So regarding the complications, there are complications of injecting any material inside the testicle. These complications are the hematoma and fibrosis. This hematoma and fibrosis may lead to further destruction or further atrophy of the testis. This is significant, or it is of significant importance in all of the 3 techniques, but it has some more significance with PRP, because as we said, PRP is sometimes given in patients who are not azoospermic. So these patients are having sperm in the semen. When we inject the PRP inside the testicle, if it caused fibrosis, if it caused damage to the testicle, then this patient who is having some sort of sperm in the testis but of lower quality will end up with losing the spermatogenesis and with azoospermia, or it may lead to disruption of the blood testicular barrier and may lead to what we call anti-sperm antibodies. So we'll shift the patient from one problem to another problem. So this is more accentuated in cases with PRP. Coming to the most serious complication, which is the carcinogenesis. This is evident in cases with stem cell. Why in case of stem cell? Because we are injecting cells with genetic material. This genetic material can lead to growth of any form of cell. Instead of growing into a sperm, it can grow into a tumor, whether malignant or benign tumor, but at least it's a tumor. It can lead to growth of abnormal tissue that is not supposed to be in the testicle. It can lead to fat formation or even muscle formation inside the testicle, which is a foreign body that will lead to more destruction in the testis. So this is a very, very, very important complication with stem cell. It's not there with exosome because we said that exosome doesn't have genetic material, and the PRP, of course, doesn't have genetic material. What other complications are there? There is a complication that is very important, which is the ethical complication that these types of medication or these types of therapy are given as a treatment. So the patient is paying a high price for the vast amount of money, although, as we said, all of these are still experimental. By ethics, by science, experiment should be free of charge. I should not charge the patients thousands of dollars or thousands of pounds or reals for an experimental therapy, even if the patient knows this. So with stem cell, especially with stem cell and PRP, it is very experimental, and the results are very, as we said, very low evidence, giving the patient a hope and taking from them money for this hope because they are desperate, because they want to do anything to have children. I think this is a very big ethical problem.
Thank you so much. And finally, I think we need to conclude. Um, so I just need a conclusion from Dr. Arafa by one. If you advise the patient what to do in cases of offered stem cell injection, exosome, or PRP.
So regarding the stem cell, I totally recommend against going for this therapy for the time being. It is not a type of therapy. It is still experimental. It is still, there is no protocol for it. And the protocol is very complicated. As we said, it is not only injection, it is a series of action that should be taken: extraction of the stem cell, stimulation of the stem cell, injection of the stem cell, and again stimulation of the stem cell. So the protocol is still very complicated and we are not there yet. So this is a definite no. For the exosomes, I said this is the near hope, but again, it shouldn't be used by everyone. It is experimental, so we should the scientist or the physician should be very honest when he is providing this for the patient as a research base, free of charge, telling him about the results that it's suboptimal. We don't have yet definite results. It is, of course, less complication, as we said, but there are still some complication with it. For the PRP, very suboptimal results. It can cause definite harm, especially if used in patients with oligoathenoteratozospermia, not isospermia. And again, it should be done by paying money. Nevertheless, the research should go on. We must encourage research. We must encourage universities and institutions to do a proper research for the three treatment modalities. This is the future. This is the breakthrough for our desperate patients. So instead of just saying stopping and not doing any research, it should be done properly. We should have randomized controlled studies. We should have solid results. So these patients, we can really help them instead of leaving them for others to just do experiments for them. Even they may not be injecting them with stem cells, but they are just playing on their hopes. Thank you.
Thank you so much, Professor Arafa, for this rich scientific based advice. And I hope that this information will be useful for raising the awareness about these three techniques: the stem cell injection inside the testicle, the exosome injection inside the testicle, and the PRP. And finally, thank you so much.
Thank you, Dr. Muhammad.